Madam Vini Mahajan. So Madam Vini Mahajan is Additional Chief Secretary, Department of Housing and Urban Development, Government of Punjab. And her current responsibility, she's holding the ACS charge of Department of Industries and Commerce, IT, and Investment Promotion since August 2018. And an economics graduate from Lady Shri Ram College. She has completed her MBA from IIM Calcutta in 1987 and joined as Indian Administrative Services in the same year. So during her term as Additional Chief Secretary of Department of Revenue, Rehabilitation and Disaster Management, Punjab became the first in the country to roll out the National Generic Document Registration System. So ma'am, you have worked as a top bureaucrat in health sector for quite a long period of time in the past, and now you are spearheading the COVID pandemic at state level in Punjab. So in the state with special challenges like Punjab being a frontier state, there is a lot of NRI population, its economy is based on agriculture, and now there is an issue of out-migration of workers to different states affecting sowing work. How do you see the role of bureaucracy in leading the battle against COVID in the state?
Thank you very much, Dr. Sonu Goyal, and thank you to all participants in this program today. You've asked a very difficult question. We are all, I think, together trying to learn about COVID, a new disease, a new virus, and trying to understand how to deal with it. In particular, we saw the experience of other countries in the world which went through devastation as even the advanced countries saw such large outbreak and so many people requiring intensive care or requiring ventilatory support that the hospitals were overburdened. And we had horrific images of people dying because they could not get the required medical treatment, even in countries that we considered highly developed and prosperous. And so in India, we followed the trajectory of our own choice, which was to do a very hard lockdown, which was to prevent the spread of this pandemic. And in particular, the effort was to use the time gained to ramp up our infrastructure. We all know that the medical infrastructure has to be taken to a level where, should the number of cases rise, we should be able to deal with them. We very quickly learned that this virus results in a problem where about 80 to 85% cases are asymptomatic or mildly symptomatic. They do not need advanced healthcare. But yes, in a country like ours, where there are slums, where there are situations where people cannot actually be strictly isolated or quarantined, we came up with the concept of COVID care centers as institutional isolation facilities. We realized that there are about 15% cases which need oxygen support, and we quickly ramped up our hospitals, district hospitals, subdivisional hospitals, even community centers for piped oxygen supply or even cylinder support for such patients as would need the oxygen support. And most important, we know that there are 2 to 5% cases which perhaps would need intensive care and ventilatory support. And we quickly assessed which are the ICU beds, the ventilator beds in our public and private sectors, and how do we work together, the government as well as the private sector, to make sure that when the requirement arises, should it arise, we should be able to provide COVID patients with the care they need. But at the same time, we are also conscious of the fact that in our country, there are other healthcare requirements, there are non-COVID patients, and we have to be absolutely able to continue to be able to give them services, including public health services relating to immunization and others. So this was a complex exercise. I think it is a wonderful effort jointly by the Government of India and its various institutions, including the top academic and research and healthcare institutions such as AIIMS. Of course, Niti Aayog played a stellar role, and institutions like PGI in Chandigarh, and also I think the state health and medical education departments working in tandem, working jointly to ensure that all the learnings global learning as well as national learnings are very quickly disseminated, are very quickly adopted, put in practice. And I believe that we have been able to ensure that by now, as the lockdown is easing up nationally and in all states, we can say with some degree of confidence that we have ramped up our healthcare, both in terms of infrastructure and in terms of human resources. And we are confident that we will be able to deal with any upswing that might happen, because we also know that the lockdown leads to economic activity taking a hit. There was a long period when there was no industry or economic activity worth the name. And that kind of economic distress also cannot be prolonged beyond a point. So I think the country as a whole, as I mentioned earlier, all institutions jointly have applied their minds to this, have tried to ensure that while on the one hand, the health requirements of the people are not neglected, they in fact have taken priority always, but at the same time, we should be in a position where we allow economic activity to resume so that the people's misery is not compounded by their economic stress.
Wonderful, ma'am. So a similar question related to the answer which you have already given. At a point of time, there was surge of cases in Punjab. And now we have been seeing over a period of time, it has become stabilized or even they are coming down. So whom do you want to give this credit to, and what special measures you have taken in this regard?
I think we all know that in India, the virus was brought in, of course, from foreign travelers. And Punjab and other states, which have a large number of NRIs coming back, there was obviously a very serious threat. And we did see that. We saw that a single person coming in, if in the beginning, when there was not enough awareness in the population, there was spread of the virus from within the family and to other close contacts, and we saw hotspots emerging. So I think there has been a massive IEC effort, and that is really critical. There has been a massive public health effort with teams going house to house, village to village, ward to ward, and trying to determine which people are symptomatic or which people may have been contacts of known positive cases, to be able to quickly alert them, to isolate them as required. There have been massive efforts at making sure that we do not allow the positive cases to infect others. And I think those showed results. There were periodic spikes. We know that there were some people who returned from other parts within India, from Nanded Sahib, from Kota, from other places. Some of them tested positive, and there again we saw a spurt, but again a massive exercise in making them go through institutional quarantine, in making sure that their contacts were limited. I think the health department has done a wonderful job. The medical education department, which is dealing not only with the level 3, the ICU facilities, but also ramped up testing in such a big way. We know we had zero facility for coronavirus testing, even in the early March 2020. And then lab after lab in medical colleges, institution after institution got up and said, we will start doing COVID testing, and RT-PCR testing expanded majorly so that we could with confidence say which person is positive and therefore needs isolation. I think the credit goes to many, many people, but there is a long way to go. We all understand that, and therefore it's too early to celebrate. We will keep working together. The state government, the central government and its institutions, the health and medical education departments, of course, are bearing the brunt of this battle. They are the frontline departments, but all other departments, all other parts of the government, every officer is supporting this effort, and we are trying to do our best. But the citizens and their response has been key. And I think if we want to congratulate anyone, we must congratulate the citizens of our state and our country who quickly recognized what the issues are and responded to them.
Thank you, ma'am. It was a laudable effort by state of Punjab, especially in this situation when it is a challenging state. And you and your team has wonderfully done well in managing this COVID pandemic in the state of Punjab. Thank you much, ma'am. Thank you for your time, ma'am.
Thank you very much.